what I'd like you to do is just tell us, the audience, what you originally had coming into the office, what kind of things you were dealing with, and then we'll just continue on from there. So you can start with your name if you'd like, and go.
Okay, yes, I'm Donna Hobbs, and I started seeing you in June of this year after being diagnosed with low thyroid.
Okay.
But physically, where I was, I had tremendous joint pain.
Okay.
I could hardly walk, and as a matter
So it was in your lower extremities?
Yeah, just all over. My elbows, my wrist, and my knees, my feet. The doctor, I was getting ready to go to Europe, and the doctor, I could hardly walk, so he gave me a shot for pain and a shot for inflammation, and gave me a prescription for Celebrex.
How long were you dealing with that?
Probably all winter, and it just kept getting worse. And, nothing was taking care of it. I would come home after I played tennis and golf, but I would get in the pool, and that helped. And I tried to walk and ride my bike, and that would help, but it always came back. Came back.
And you had the pain. Did you have? What other symptoms did you have with the thyroid?
Well, I was not losing weight, and regardless of what I ate or what I didn't eat or how much I tried to diet or not diet, I just was always gaining weight. And that was, I've been trying to track that down for years.
Okay. So, okay. And was there any fatigue or anything?
Yeah, I was tired all the time.
Okay.
I'd wake up tired. I took lots of naps, but I was pretty much tired all the time.
And was there any mental fogginess?
Yes.
Okay.
There was a tremendous amount of mental fogginess.
All right. So there was pain in joints all over, fatigue, mental fogginess, and weight problems.
Yeah, the weight problem. And, the doctor would say, you need to exercise more. Well, you know what? There wasn't any time left to do any more exercise. I was playing tennis 3 or 4 times a week. I was playing golf. I ride my bike. I would swim laps daily.
So you weren't short of exercise.
I was not short of exercise.
And the only solution they were giving you was the hormonal replacement and then the shots for the pain. Were there any other things that they were recommended?
Well, I was just, before I came here, it was the first I was diagnosed with thyroid. And so my internist in Florida gave me a prescription for Armour.
Okay.
And it was in April, which that diagnosis came in May. But it was in April, just before leaving for a trip to Europe, that I went to the doctor about the pain I was in, because I was afraid I wouldn't be able to walk around.
So did the pain stop you from doing activity?
No.
But
I knew that I wasn't injured, so I refused, and I wasn't ready to hang up my tennis shoes. I would just do what I needed to do. I was very limited. I couldn't, particularly on the tennis court, I was just not able to move, but I still would go and play.
Okay.
And but I found that after tennis, if I got in the pool and swam and stretched out, and then walked a little bit or rode my bike, that helped with keeping me mobile. I didn't freeze up, but there was always pain.
Okay. How much did you rank the pain? Like between 0 and 10, where was it?
A 55.
Okay, so it was intense.
It was intense.
So you went through, started the program, you followed it pretty well, actually.
When I came to see you, and I told, I was on the Celebrex, and but you started me on the diet before you started me on Repair Bite, I think for like 3 weeks. And then I started the Repair Bite. But within 2 to 3 weeks, even before the Repair Bite, the pain was pretty much gone. I didn't have to take the Celebrex, and I haven't had any pain since.
So you went from a 55 down to a 0?
Absolutely.
Okay. And how are the other things doing now? The fatigue, the brain fog, all those things?
No fatigue. Much better on the brain fog. And I've lost 30 pounds.
I didn't know that. Okay, I thought it was less than that. So 30 pounds?
30 pounds, 3 sizes.
How long was that then? That's 3 months then?
Yeah, 4.
Okay, because you were on it for a few weeks before.
I started in June to July, August to September to October.
And you're keeping it off?
Just shy of 4. Yeah, I am.
Cool.
Yeah.
So what would you say to a person who's contemplating...
Well, going back to the weight, I don't think about it as keeping it off. I don't even think about the weight. I think about staying away from the foods that that I'm to stay away from.
So did you find it easy in that respect? Because once you started feeling better, was it easier for you to make those decisions?
Yeah, but it wasn't about the decision. The challenge was being organized with having the food that I could eat and putting meals together. And it took me about maybe a week to get that, knowing what my breakfast options were and what a good balanced lunch was and dinner. And once within a week, had that organized, it's all been very easy.
Okay, so once you were feeling better, it became easier to make those decisions.
Absolutely,
yeah.
Absolutely.
So what would you tell a person who's contemplating doing a program, and they maybe have less symptoms than you or more symptoms than you, but they're thinking, okay, is this going to be worth it? What would you tell someone?
Well, learning about inflammation, Hashimoto's and what that is, and also in my own personal belief system about how our food source has been compromised. And you just take a look at people out there on the streets walking around, they're miserable. And I don't think anybody chooses to be fat. I don't think anybody chooses to be in pain. I think people don't know how to get help. And I think, as I said, I've been trying for years to find help. And I found it here.
Cool.
I found it here. But it all started, I didn't mention to begin with, this all started when I had routine blood work and my blood glucose was high. And my doctor thought that I had diabetes and suggested that I go to an internist to check on that. And when we did the follow-up, was it A1C? That was very low. So my internist says, you don't have diabetes, but you have a thyroid issue. So I got here via that. But I found Dr. Schiller from my personal trainer.
Right.
When I told her that the thyroid issue, she said, well, you may want to check into the Connecticut Thyroid Clinic.
Okay. All right. Well, I thank you, and I'm glad you're doing better.
I'm doing great.
All right, great.
And I would recommend it. Yeah, I think, this is it. This is the solution.
Cool.
This is the solution.
I appreciate the good words. All right. I hope this encourages someone to do something about their own health. So thank you.
You're welcome.
All right.